Good evening, everyone. I want to thank you for joining tonight's live Facebook conference on non-pharmacological approach to treatment of migraines. My name is Dr. Shivang Joshi. I'm currently a neurologist and headache specialist at the Dent Neurologic Institute. My background is I have a master's in public health. I also have a degree as a pharmacist as well. I went on to complete a neurology residency, and then furthermore, I completed a specialized fellowship in the treatment of headache medicine. I am pleased today to be talking about a non-pharmacological approach to treatments of migraines. So today we're going to talk about several things. We're going to talk about lifestyle modifications. We're going to talk about triggers. We'll talk about behavioral aspects, and then treatment using physical techniques, vitamins, neuro stimulation, and also some medical things to consider as well. So first of all, why even talk about non-pharmacological approach? The reason is quite often patients have adverse reactions to medications. Patients also have certain drug interaction problems. They may also have medical conditions that might limit their ability to take pharmacological medications. Some patients might also have poor response to pharmacological medications. Another consideration is patients who are pregnant, considering pregnancy, or lactating. So in these considerations, a non-pharmacological approach may be more optimal. Now, what are migraines? So it's to simplify it, migraines is a complex brain disorder, but it's also a biopsychosocial disorder, which means that it's a disorder of the brain, which is the bio portion. It's also a psychosocial component, means that you also have environmental, social, and psychological factors that can affect migraines. So this is the reason why we have a different approach for treatment of migraines. We have a comprehensive approach as well, too. So let's dig into this. Let's talk about lifestyle modifications first. Let's talk about sleep first of all. Now, sleep hygiene is very important in many different disorders, especially migraines. When I say sleep hygiene, I'm referring to not your clean pajamas. I'm referring to making sure that you sleep at the proper time every day, making sure that you're not engaging in activity that would stimulate your mind when you're sleeping, such as reading from the bed or late evening caffeine. So sleeping at the same time every day is important, and also decreasing your caffeine intake as well. Now, another thing to pay attention to with regards to sleep and headaches is, are you grinding your teeth or are you clenching your teeth? Sometimes you might wake up with some pain in the jaw area. That might be a sign that you might be grinding or clenching your teeth. And this may result in some pain in the temporal area of the head. In addition to sleep, we should also consider hydration too as a lifestyle or behavioral lifestyle modification. Hydration is very important. So making sure you drink plenty of fluids throughout the day, especially in the hot weather, is important. Also, not just regular fluids in electrolytes are also important as well. Now, skipping meals is another trigger for migraines. Now, maintaining a normal glycemic control is very important, which means not only low sugar, but if you have elevated sugar or fluctuations of sugar, is not good. Remember the brain is the brain doesn't like change. And any change that it creates a headache or creates another a storm. So brain in general doesn't like change, so we want to maintain our glycemic control, maintain our hydration. Caffeine intake as well. I think that I usually don't advocate eliminating caffeine completely unless it's a specific trigger for patients. I think that sometimes if you consume too much caffeine, it may produce something called a rebound headache or a medication overuse headache, in which the caffeine is actually acting as a drug. So be cautious with caffeine. Sometimes what you might want to do is consume a cup of coffee and then have it consume it throughout the day over a period of time instead of taking it in very quickly, because by itself you can have rebound effect. Regular exercise is very important. It's important for multiple things, cardiovascular wise. It's also important for the immune system as well. So I encourage regular exercise in anyone who has migraines. Now let's move on to triggers. Now, triggers are very difficult to study. There's a lot of research in migraines. There are a lot of clinical trials called randomized clinical trials, but migraine triggers are variables that are very difficult to study because sometimes a trigger may not be a trigger, but on another day it might be a trigger. I'll give you an example. Certain triggers that are not under your control include barometric pressure changes or weather changes, okay? And triggers that you may have certain control over include avoiding strong odors. For example, if you work with bleach, you may put on a mask as well. If you're under strong bright lights, you might consider avoiding them. Also, blue lights tend to be a trigger, or blue wavelength of light tends to be a trigger. So sometimes glasses that particularly block the blue wavelength of the light may be helpful. So lights, odors, and sometimes avoiding cigarette smoke can be a trigger, can be beneficial as well. Now, let's talk about certain food triggers. I know there's a lot of you out there that are thinking about chocolate. So I don't necessarily want to take away your chocolate. Now, chocolate is very interesting. There are different phases of a migraine. One of the earliest phases of a migraine is called a prodrome phase, which is the early phase before the actual headache sets in. Now, during this phase, patients can have cravings. They may crave salty foods or sweet foods, among other things, including yawning, increased urination, things like that. So now imagine you have a craving for chocolate, and then you develop a headache afterwards. You would automatically associate getting a headache with the chocolate, but it might not necessarily be the case. So that's something that you may want to just keep in mind, that it's not necessarily a trigger. Certain things that are well-known triggers include artificial sweeteners. So you might want to avoid aspartame as well. Look in the back of packages to see what contains aspartame, and also processed food in general. Aged cheeses, foods such as lunch meats, cured bacon. Any cured foods will contain nitrates. So there are uncured versions that are available that you may want to consider as well. Also, foods containing monosodium glutamate may be a trigger as well. These are found in various different ethnic foods. They're also found in certain salty type foods as well. Now, remember one thing that I mentioned. One day a trigger can be a trigger, but one day it may not be a trigger. So sometimes you may have weather changes, and then that same day you didn't sleep well, and then you ate something that was a food trigger. So you might have a combination of several things causing the trigger. So that's to take into consideration as well. Now, let's talk about therapies. So there's several different therapies. In talking about behavioral therapy, so behavioral therapy actually has Class A evidence, which is the highest level of evidence for effectiveness. There have been a lot of clinical trials to show effectiveness. In fact, behavioral therapy is on par with certain preventative meds that are used, or pharmacological medicines. So let's talk a little bit about behavioral therapy. Now, behavioral therapy includes biofeedback. So biofeedback is basically a device that monitors your body function. And you can do it through temperature. It's called thermal. You can also do it through EMG. And what they're essentially trying to do is, the goal is to train your body to decrease your nervous system arousal. So remember, the brain is an excitable. Migraines are caused by brain hyperexcitability. So what you're trying to do is decrease neuronal or brain arousal by using biofeedback. And biofeedback can be safely used during pregnancy as well. Another behavioral therapy is cognitive behavioral therapy, where you typically specifically find a behavioral trigger for a person, and then if it's a risk for their headaches, you address that through behavioral techniques. Another component of behavioral strategy is relaxation techniques. Now, relaxation techniques involve basically muscle exercises paired with controlled breathing. Now, breathing is very important. I'm going to touch on yoga in a few minutes, but deep breathing actually stimulates something called the vagus nerve. And the vagus nerve is a long nerve that goes from the head area, the brain area, all the way down into your stomach and lower. Now, the vagus nerve can produce some inflammation. So deep breathing might help with this. So it's another reason why yoga might be beneficial. In terms of physical treatment, physical therapy is helpful. Yoga, there's something called myofascial release. Basically means muscle, and fascia refers to there's a covering on the muscles that sometimes can be irritated, triggering the nerves, causing pain. Now, myofascial, there are people who are experts in doing this. As far as chiropractic manipulation, I think that if it's a non-rapid manipulation, gentle manipulation, there are techniques that can be used to do this that are effective without causing any harm. Acupuncture, there's mixed data with acupuncture. It doesn't do any harm. So I think that even if there is some placebo effect with some of this, if it works for you and it is affordable, it is something that you can consider. Now, there has been this little buzz about this piercing. It's called a date piercing. Personally, I would suggest that there's no real evidence. And part of that is because the people who do have benefit, if they have a benefit, that's great. Sometimes people who do have a benefit are the only people reporting the benefit versus people who don't have a benefit don't report it. So we don't actually know who's benefiting and who's not benefiting. So just to take that into consideration as well before you go and pierce your ears for that. Now, as I mentioned earlier, deep breathing technique reduces inflammation. Acupuncture helps with this as well. And now moving on to over-the-counter or vitamins or minerals. Now, there is plenty of evidence for something called vitamin B2. Another name for vitamin B2 is riboflavin. Riboflavin has several different functions. It's a cofactor for parts of the cell in the human body that generates energy. So there's a lot of biochemical benefit to riboflavin. And the way you would take it is typically 2 tablets twice a day. Each tablet is 100 milligrams. And it's encouraged to take it twice a day, not a large dose once a day, because we call something called a half-life, which means the amount of time for the drug to clear the body is very short. So riboflavin can be cleared very quickly from the body, so it's better to take it twice a day. There may be some extended release preparations available as well. Another thing that I do like is magnesium. In particular, magnesium is very helpful during the menstrual component to migraines, during perimenopausal migraines. These are times when migraines can be more active and more sensitive, and primarily this is related to hormonal changes. Now, we know that during pregnancy, there's an increase in estrogen. So typically that generates more visual aura and decreased migraines. In general, migraines are decreased during pregnancy. Now, magnesium can be safely taken throughout pregnancy, and sometimes it is used to treat certain conditions in pregnancy. So magnesium during perimenopause is very helpful as well. It may even help decrease some of the hot flashes and night sweats as well. Now, with the use of magnesium, when we give these patients, it doesn't necessarily mean that we are thinking that the patients are deficient or low in magnesium. That's not necessarily the case. There are very unique conditions that may have that as well, but that's not why we're giving magnesium. And I quite often get that asked as well, do I need to check my magnesium level? In general, the answer is no. Now, in talking about neurostimulation, so neurostimulation is, there are various different techniques of stimulating the nerves. Now, remember, we have nerves that are on the outside of the body, and we have nerves on the inside of the brain as well, too. Sometimes there are some nerves that have connections. Nerves in this higher cervical vertebrae level, namely the cervical 1 level and cervical 2 level, have nerves that communicate with the nerves within the brain. There's a lot of communication that takes place. And you guys remember when I mentioned the prodrome phase, the early warning that a migraine is coming. One of the prodrome phase is neck stiffness. So it might not necessarily be that you had neck muscle spasm and that triggered the headache. It might be an early warning sign that the migraine is about to come. So there are several different treatment options available now as far as neurostimulation. So there is something called single pulse transcranial magnetic stimulation, which is indicated FDA approved for the treatment of migraines with aura. And it basically releases a energy pulse and you put it on the back of your head. Another is a supraorbital stimulation. It's a device that you put above in your forehead area, and it has electrical stimulation that is supposed to help with modulation. Modulation basically means we're trying to affect the outcome of stimulation or decrease the arousal effect of the brain. The other one is something called the non-invasive vagus nerve stimulator. It is currently FDA approved for treatment of something called cluster headaches, which is separate from frequent migraine headaches, which sometimes people refer to them as cluster. but I'm talking about a very unique headache disorder called cluster headaches, which is a whole separate topic on its own. It is also has been tested in clinical trials for the use of migraines. And it basically is a device that you apply to the vagus nerve, and it stimulates the nerve and hence decreasing the migraines. So those are some of the devices that are available. Now, in terms of medical things to take into consideration. So quite often patients will have fluctuations in their thyroid levels. And any fluctuations in thyroid levels can be a trigger for migraines. There are patients who have this diagnosis called Hashimoto's thyroiditis. Sometimes it does respond to magnesium. In particular, I like to use magnesium oxide. There are various different formulas that are available over the counter. Magnesium oxide has been effective. The things to watch out for, sometimes in the beginning you might have some loose stools. There's also glycinate. Each one has different absorption panel from the stomach. You might have increased absorption from, let's say, the glycinate. I wouldn't recommend using the citrate in a liquid formulation because it tends to be used more for bowel preps. So Hashimoto's thyroiditis, endocrine disorders such as thyroid disease to take into consideration. Also, diabetes is an endocrine disease as well. So making sure that your sugar fluctuation, you're not having fluctuation is important as well. So diabetes, thyroid, regular exercise, addressing cardiovascular disease, because in general, what we know now about migraines is that it's a disorder of brain inflammation. So if you can help reduce brain inflammation by using non-pharmacological approach as well as pharmacological approach, it's better. Now, I know some of you may ask me out there about the use of turmeric. I haven't seen turmeric being used in migraine treatment. Turmeric is a spice that's used in certain ethnicities, and it's a yellow powder, and it has several different properties, including anti-inflammatory, anti-immune properties. So it may be useful in certain other anti-inflammatory conditions. The particular caveat about turmeric is that it's not absorbed well into the body unless it's in its active form, which is curcumin, or if it's combined with black pepper. So these are some of the things that I would use. Now, there's something called butterbur that has been used, but I think that we're losing more favor of using that now because there have been some issues with liver toxicity associated with that, so I would not recommend butterbur. So in summary, we've looked at several different aspects today of non-pharmacological means. We looked at lifestyle modifications. We looked at triggers, modifiable triggers, non-modifiable triggers as well. We looked at behavioral aspects. We looked at physical treatment. We talked about a few vitamins as well too, and we talked about neurostimulation as well. Now, it's very important that before you engage in any of these activities, have a discussion with your primary care doctor or your neurologist if any of these things that I mentioned earlier are right for you as well.